Today's topic is viral hemorrhagic fevers. So what are the viral fevers causing hemorrhage? Give me one name. The most common, which occurs dengue, yes. It occurs throughout India and Bengal. Yeah. And so this will be a very important topic for both your theory and viva and this upcoming examination. Your dates has been announced. You have got the dates for your examination? 4th, it starts from 4th June, I think. 8th June, yeah. So what are viral hemorrhagic fever? These are clinical multi-system illness associated with fever and bleeding tendencies caused by several distinct families of viruses. Okay, so with the name, as the name suggests, ঘুম হয়েছে হয়নি একটু সামনে বস kindly. As the name suggests, they will all have an initial non-specific prodromal stage followed by fever, malaise, headache, myalgia and arthralgia, abdominal pain and non-bloody diarrhea. Then they progress to more severe symptoms and death. There is hemorrhage, increased vascular permeability, hypotension and shock leading to multi-organ failure. In many cases cause rapidly progressive illness and high mortality rates. So, what are the initial stages of viral hemorrhagic fevers? Fever, malaise, headache, myalgia and arthralgia, abdominal pain, non-bloody diarrhea. Then there will be hemorrhage, increased vascular permeability leading to hypotension and shock leading to multi-organ failure. Now what are the causative viral groups? There are filoviruses and the representative viruses are Ebola virus and Marburg virus, Flaviviruses, yellow fever and dengue fever and West Nile fever. Of this, yellow fever and dengue fever is the most common and most important. Bunyaviruses causing Rift Valley fever, Crimean-Congo hemorrhagic fever, Hantavirus. You can expect a question from Hantavirus also, as you know this Hantavirus is coming. Okay, and Arenaviruses causing Lassa fever, and among these are Lassa fever virus and New World Arenaviruses. So what are the causative viral groups? Filoviruses, Ebola viruses and Marburg viruses, Flaviviruses, yellow fever virus, West Nile virus and dengue fever virus, Bunyaviruses, Rift Valley fever virus, Crimean-Congo hemorrhagic fever virus and Hantavirus causing Hantapulmonary syndrome. Among the Arenaviruses, these are Lassa fever virus and New World Arenaviruses. You will have to remember all the names of at least all these 4 viral groups. Okay. Among these are the larger classification, and with the vectors and geographic distribution, this you don't have to remember so much. Now coming on to these biological features, all of them are single-stranded Arenaviruses. Yellow shirt. So what are the major groups of viruses causing viral hemorrhagic fever? All of them are single-stranded Arenaviruses. All are enveloped viruses and infectious during the viremia stage. They are low infective dose. At least 1 to 10 viruses can cause infections and geographically restricted only to areas where the host lives. Humans are not the natural reservoir but are accidentally infected when comes in contact with the infected host. The human outbreaks are sporadic and irregular. So what are their features? All of them are single-stranded Arenaviruses, remember this. All of them are enveloped, geographically restricted to only areas where the host lives. Humans are not the natural reservoir but accidentally infected when comes in contact with the infected host. Human outbreaks are sporadic and irregular. When human is infected, can infect another human, and there is no established treatment except for symptomatic. They have also a role in bioterrorism, biological weapons due to high morbidity and mortality and due to aerosol transmission of most of them except dengue fever viruses. Epidemiology. These hemorrhagic fever viruses are zoonotic viruses Animal hosts, rodents and arthropod vectors are the main reservoirs. So, what is zoonosis? Zoonosis are known as in which viruses the main reservoirs are animal and arthropod vectors. Modes of transmission: natural infection of the humans occurs due to bite of the infected arthropods, ticks or mosquitoes, and aerosol from infected rodent excreta and direct contact with infected animals or carcasses or fomites. Mainly is caused due to bite of the infected arthropod. So, these are also known as arboviruses or arthropod-borne viruses. Most person to person spreads due to direct contact with infected blood and body fluids, hospital acquired infections, mucous membrane contact, aerosolized, airborne in Ebola fever virus, Lassa, Junin and maybe yellow fever. And incubation period is ranging from 2 to 21 days for all of them. Pathogenesis: as they are hemorrhagic fever viruses, in most of their cases, the target organ will be the vascular bed, causing hemorrhage. The replication of the virus occurs intracellularly and there is cytokine release leading to shock and hypotension. This affects the platelet functions and numbers, causing thrombocytopenia, affects the bone marrow and also the clotting factors. Case fatality rate: in filovirus, the mortality rate is around 90% for the Ebola virus, which is the highest. Flavivirus is 0.5% and Arenaviruses is 15 to 30%. So, the highest mortality rate is reported, Sumon. So, the highest mortality rate is noted for Ebola viruses. সুমন, আর এগুলোকে জুনোটিক ভাইরাসেস কেন বলছি আমরা? জুনোটিক একটু শোন। In causes of death, it will be due to hemorrhagic diathesis. Several bleeding occurs from several body sites and orifices, shock and leading to multi-organ failure. Differential diagnosis: infectious conditions are influenza, viral hepatitis, staphylococcal or gram-negative sepsis, meningococcemia, salmonellosis and shigellosis. And non-infectious conditions are DIC, ITP and acute leukemia and vasculitis and collagen vascular diseases. Now, coming on to the detailed description of these viral hemorrhagic fevers. The group 1 is filoviruses. Ebola virus and Marburg viruses fall within this group. These are category A bioweapons and potential to cause widespread illness or death. The ease of dissemination: how do they cause bioterrorism? Because they have an ease of dissemination or person to person transmission. The Ebola virus was first appeared in Zaire and Sudan in 1976 and the outbreaks occurred in 2013 in Liberia, Sierra Leone and lately to Nigeria. The case fatality rate of Ebola virus approaches almost 90%. This virus was transmitted from the humans to the humans from wild animals. Natural habitat: fruit bats are considered as the natural host for this virus and other reservoirs are rodents and plants virus. How do this transmission occurs? By direct human to human contact with the blood or other body secretions like saliva, breast milk, tears, stool, skin or semen of the infected persons or even dead bodies. The laboratory staff are mostly at risk. Transmission through semen can occur up to 7 weeks after recovery. Sexual transmission: indirect contact transmission by environment contaminated with such infected secretions or by handling ill or dead infected chimpanzees or other infected animals. The healthcare workers have frequently been infected while attending the patients due to direct body contact with the body fluids and needle stick and also aerosols. And they cause severe hemorrhagic fever that is similar to fulminant septic shock. They have a mortality rate of Ebola in 50 to 90%, Marburg virus 25 to 30%. Incubation period Shumon koto? This is 2 to 21 days for Ebola virus, mean will be 8 to 10 and 3 to 10 days for Marburg virus, and there is 6 days takes from onset of symptom to death. Without treatment, the patient will go on to death. When a case of viral hemorrhagic fever, if comes to your question in this theory examination, it will come as a patient has come to the OPD with history of bleeding spots or hemorrhagic spots all throughout his body, and there will be a history. Like if the Ebola virus comes, there will be a history of whether the person is a healthcare worker, which was he or she was attending patients in a Ebola virus cases in a hospital, or there is or they have traveled to a places like Africa where there has been an outbreak of Ebola. আর যদি ডেঙ্গুর যদি কোয়েশ্চেন আসে তাহলে আসবে রিসেন্ট বাইট মসকুইটো বাইটের হিস্ট্রি, ঠিক আছে? ডেঙ্গু বা ইবোলা কিন্তু এই সামনের থিওরি সেমিস্টারে কিন্তু আসার খুব ভালো চান্স আছে। ভাইরাল হেমোরেজিক ফিভারসটা প্রচন্ড ভালো করে পড়বি, কেমন? The Filovirus family includes Ebola and Marburg virus, যেটা আমরা পড়ছিলাম তনিষ্ঠা। These are all single-stranded Arenavirus enveloped viruses. The Ebola virus contains 5 strains with different phylogenetic tree. They have high mutational potentials and rapidly replicating U or 6-shaped viruses. এই রকম দেখতে হয়, U অথবা 6-shaped এর মতো। তাহলে most of these viruses are single-stranded RNA viruses and have high mutational capacities. Okay, bleeding from the conjunctivitis, bleeding the spots all over the body. Okay. Now coming on to the Flaviviruses group. Flaviviruses এর মধ্যে কি কি পড়ছে? Yellow fever virus, dengue fever, OMSK hemorrhagic fever and Kayasuna forest disease. Flavus means in Latin means yellow, সেই জন্য এই গ্রুপটার নাম হয়েছে Flaviviruses due to this yellow fever viruses. Mode of transmission: yellow fever is transmitted by the bite of the infected Aedes mosquito, Aedes aegypti, Aedes africanus, falciparum and albopictus. And dengue fever occurs due to the bite of infected Aedes aegypti. Kayasuna forest disease occurs due to the tick bite. There has been no reported case of person-to-person transmission. Yellow fever virus, dengue fever virus, OMSK hemorrhagic fever and Kayasuna forest disease. Yellow fever occurs due to the bite of এবার সূর্যকে জিজ্ঞেস করব next question. This occurs due to the bite of the Aedes mosquito. Dengue fever especially due to the bite of the Aedes aegypti mosquito, and Kayasuna forest disease occurs due to tick bite. There has been no reported cases of person-to-person transmission. The yellow fever cycles, the 3 cycles for yellow fever: jungle cycle, urban and intermediate cycles. In jungle cycles, non-human primate থেকে mosquito bite, then again goes to non-human and mosquito bites. But when this mosquito bites this humans, urban cycles occurs. From the infected human, again mosquito bite occurs due to Aedes aegypti, and then this mosquito again bites another human, and this transmission goes on. Okay, these are the Flaviviruses. These have the E dimer, M protein and capsid protein. এগুলো অতটা আসছে না important. This is very important. Yellow fever, they have a short incubation period of 3 to 6 days. What are the initial symptoms? The initial symptoms are fever, chills, severe headache, back pain, muscle aches, nausea and fatigue. Most symptomatic patients develop only this stage. However, in 15% of the symptomatic patients, severe form will develop after a short symptom of remission, leading to toxic shock. In toxic phase, the fever returns with initial symptoms plus coagulopathy and hemorrhage will occur and hematemesis, black vomit. তাহলে সুমন পেশেন্টের কি নিয়ে আসবে? ব্ল্যাক ভমিট ডিউ টু ব্লিডিং, ওকে, ডিউ টু hemorrhage. Okay, this is the toxic phase of this yellow fever, and there will be jaundice, hypotension, shock, metabolic acidosis, arrhythmia, confusion, seizures and even coma can occur. কি কি সিমটমস গুলো হয়? রেড আইজ, কনজাংটিভাইটিস হয়ে যাচ্ছে, ব্লিডিং, হেডেক, bleeding from the eyes, gums, fever, vomiting, back pain, hepatomegaly and muscle ache and myalgia and jaundice. Jaundice is one of the major symptoms of yellow fever. Jaundice হলে এরকম আর কি কি ডিফারেন্সিয়াল ডায়াগনোসিস হবে সুমন, একটা হচ্ছে ভাইরাল হেপাটাইটিস, ওখানেও জন্ডিস হচ্ছে, হেপাটাইটিস বি ভাইরাসের এ। কি করে ডিফারেন্সিয়েট করবি? হিস্ট্রি থেকে। এখানে হিস্ট্রি থাকবে এরকম মসকিউটো বাইটের, ওইখানে হিস্ট্রি থাকবে হেপাটাইটিস বি কোনো নিডল প্রিকের বা এর বা কোনো রকম ট্রান্সমিশনের, ঠিক আছে? মেজরিটি অফ দ্য patients infected with yellow fever virus have no illness or only mild illness. Faggot sign, this relative bradycardia with fever. Mortality rate has 5 to 10%, 20 to 50% in epidemics and hospitalized patients. The 90% of the cases occur in Africa and 10% in South America. The vaccine is available and indicated to travels in the endemic area in Africa or South America. Any person traveling to South America or Africa are given this yellow fever vaccine. কলকাতার একটা জায়গা থেকে দেওয়া হয়, হ্যাঁ তোমার ওই ট্রপিক্যালের ওখান থেকে দেওয়া হয়, ঠিক আছে? A live attenuated vaccine, single dose is given for more than, it is effective for more than 9 months to travelers and living in endemic areas. Immunity is seen in 1 week in 95% of the people. Protection is for 30 to 35 years. And no specific treatment is available for this yellow fever virus. 90% of the yellow fever cases occur in Africa, okay? And 10% cases occur in South America. Now coming on to dengue fever. This is always very important for your theory and practical in whichever examination you give, okay? Dengue fever was described as a breakbone fever by Benjamin Rush in 1789. This is endemic throughout in the Americas, Asia and Africa. Vector is Aedes aegypti and Aedes albopictus. This virus replicates in the mosquitoes. Very rarely occurs by blood transfusion, organ transplant and vertical transmission. Incubation period is 3 to 14 days. This is the most prevalent mosquito-borne viral disease in the world. And then 1/3 of the world population are exposed and 400 million cases occur yearly. তাহলে সুমন এটা হচ্ছে মোস্ট প্রিভালেন্ট মসকিউটো বোর্ন ভাইরাল ডিজিজ। প্রতিটা সামার সিজনের পরে যখনই রেইনি সিজন আসে, there is regularly epidemics of dengue throughout West Bengal. More than 100 countries have endemic dengue transmission. In USA, 10.4% of the post-travel systemic febrile illness or travelers return from endemic areas. Still not the specific treatment কিছু নেই. Vaccine is being developed and symptomatic treatment is only done. Okay. There are 4 dengue virus serotypes, dengue 1, 2, 3 and 4. All of them can cause severe and fatal infection. Infection by one serotype gives no cross immunity to the other types but lifelong immunity to the same serotype. However, they are more predisposed to dengue hemorrhagic fever in infected by another serotype. Dengue virus এর 4টে serotype রয়েছে, 1, 2, 3 and 4. If infection occurs with one serotype, that person will have immunity from that serotype only, but if he is again attacked by another serotype, যার প্রথমে তো ডেঙ্গু সেরোটাইপ 1 দিয়ে ইনফেকশন হলো, তারপর ডেঙ্গু সেরোটাইপ 2 দিয়ে হলো, then it will have a higher chance of progressing to dengue hemorrhagic fever and dengue shock syndrome. Okay, infection due to one serotype will not give cross immunity due to other serotypes, and if in the second time if you are infected by another serotype, you have a higher chance of getting progress to dengue hemorrhagic fever and dengue shock syndrome due to cross-reacting antibodies. Okay. Immunopathological mechanism triggered by sequential infection with different dengue viral serotypes. They have a complicated pathogenesis and partially attributable to this antibody-dependent enhancement. Humans are the main reservoir of this dengue virus. What are the symptoms of dengue fever? They have a febrile phase where there is a sudden onset of fever and headache and the nose, muscle and joint pains, vomiting, rash. These rashes, hemorrhagic rashes all over the body and diarrhea. And in critical phase, there will be hypotension, pleural effusion, ascites, gastrointestinal bleeding. And after the patient recovers, there will be altered level of consciousness, seizures, itching and slow heart rate. Clinical manifestations are undifferent. In the first part, there will be undifferentiated fever. In second part, there will be classical dengue fever, dengue hemorrhagic fever, and leading to dengue shock syndrome. What are the symptoms of classical dengue fever? In classical dengue fever, Varsha, there will be acute febrile illness, severe hemorrhage, mainly retroocular. Patient will be complaining of retroocular pain. This is one of the main symptoms of dengue. ঠিক আছে, এটা তোর কোশ্চেনও থাকবে, retrobulbar pain, eye pain with history of mosquito bite, একদম চোখ বন্ধ করে ডেঙ্গু লিখবি। myalgia and arthralgia often severe leading to breakbone fever, মানে হাড় ভাঙার মতো ব্যথা হবে, breakbone fever, rash in at least 50% of the cases of variable appearances, maculopapular rash, petechial and erythematous. In dengue hemorrhagic fever, this is the most serious form of dengue infections. The WHO estimates that there is more than 500,000 cases per year, and mortality approximately is 10%, but can be as high as 50%. WHO has 4 diagnostic criteria for this: fever of 2 to 7 days, hemorrhagic manifestations with low platelet counts, and evidence of leaky capillaries. The platelet count should be less than 10,000 per ml. Dengue shock syndrome. The 4 WHO criteria for dengue hemorrhagic fever and evidence of circulatory failure or shock. So, what are the evidences of circulatory failure? Rapid or weak pulse, narrow pulse pressure, hypotension, cold clammy skin, and altered mental status. So, dengue hemorrhagic fever e ki hocche? Fever plus hemorrhagic manifestations like rash all over the body, low platelet count, and evidence of leaky capillaries. With this, when there is evidence of circulatory failure, the patient is going into dengue shock syndrome. A patient of dengue hemorrhagic fever, if not managed rapidly, that patient will go into dengue shock syndrome. There will be rapid weak pulse, narrow pulse pressure which is less than 20 millimeter of mercury, hypotension with cold clammy skin and altered mental status. Now coming on to the third category, Bunyaviruses. Among Bunyaviruses, there are Rift Valley fever, Hantavirus and Crimean-Congo fever, hemorrhagic fever. তাহলে বুনিয়াভাইরাসের মধ্যে কি কোন কোনগুলো পড়ছে? তিনটে: রিফট ভ্যালি ফিভার, হান্টাভাইরাস and Crimean-Congo hemorrhagic fever. What are the hosts? The hosts are the arthropod vectors and rodents. Mosquitoes cause Rift Valley fever, ticks cause Crimean-Congo fever, and Hantavirus virus is caused due to this bite of rodents. All of them can be acquired by exposure to infected animals or their carcasses, contact with blood or body secretions of these infected persons, and by aerosol. তাহলে এই তিনটে ভাইরাসগুলো কি কি? These are Rift Valley fever, Hantavirus and Crimean-Congo hemorrhagic fever. Bite of mosquito causes Rift Valley fever. Crimean-Congo fever comes due to bite of the ticks, and Hantavirus is caused due to bite of the rodents. All of them can be acquired by exposure to infected animals or their carcasses, contact with blood or body fluids, and also by aerosols. Rift Valley fever, this is a mosquito-borne disease. It affects primarily the sheep and goats and also cattle, buffaloes and camels. The most human infections are unapparent. This is a self-limited febrile illness. This was first reported in Kenya's Rift Valley in the early 1910. সেই জন্য সেখান থেকে নাম হয়েছে এটা Rift Valley fever. They have rare severe forms: ocular, retina, meningoencephalitis or hemorrhagic fever form. At least just less than 1% develop typical viral hemorrhagic fever. They have a short incubation period of 3 to 6 days, and mortality is variable but less than 1%. So, Rift Valley fever, this is a mosquito-borne disease mainly affecting the sheep and cattle. Human infections are unapparent. This name has come due to first case was reported in Kenya's Rift Valley in the early 1910. At less than 1% develops the typical viral hemorrhagic fever. They have a short incubation period of 3 to 6 days, and mortality is just less than 1%. How does humans acquire infection? The humans acquire infection by bite of the infected mosquito, several species, vertical transmission for years, and contact with infected animal tissues or aerosolization of the virus from infected animals and ingestion of the contaminated raw animal milk. There has been no reported cases of human to human transmission. Standard precautions are only enough. Vaccination of animals, but not during epidemics. Inactivated human vaccine এখনো license পায়নি এর জন্য. Now, carcinoma disease, Arenavirus, Lassa virus and New World Arenaviruses. Arenaviruses are rodent-borne hemorrhagic fever viruses, mainly affecting the rats and the mice. They cause severe viral hemorrhagic fever in Africa and South America. Incubation period of 3 to 19 days. There are two types of arenaviruses, Old World and New World. The Old World is found in Africa and Europe, Lassa fever, causing lymphocytic choriomeningitis, and New World is found in the Americas, South American viral hemorrhagic fever, Junin, and the Machipo, causing the viral Bolivian hemorrhagic fever, whitewater adeno, North America, and Sabia virus causing Brazilian hemorrhagic fever. How do they transmit it? How are they transmitted? Arenaviruses. These are transmitted due to the inhaled aerosols of rodent urine or feces and due to ingestion of food or water contaminated with the rodent excreta and direct contact of rodent excreta with abraded skin or mucous membranes and contact with contaminated fomites, contact with rodent blood. Sexual transmission is likely in Lassa virus. This can survive for 3 months in semen. তাহলে এরিনাভাইরাসিস কিভাবে ট্রান্সমিটেড হচ্ছে সুমন? Due to inhaled aerosols of rodent urine or feces, ingestion of food and water, direct contact with the rodent excreta, contact with the contaminated fomites, contact with rodent blood. Sexual transmission is likely in Lassa virus because the virus can survive for 3 months in semen. Person to person transmission occurs due to direct contact with blood, urine, pharyngeal secretions or other body fluids of the patients or healthcare workers, and airborne transmission is also possible among the healthcare workers. Okay. Now, how to this diagnosis and management? Case definition: the patient viral hemorrhagic fever. The patient must have a fever for more than 40 degrees Celsius, and with that one or more of the following: severe headache, muscle pain, erythematous maculopapular rash on the trunk with fine desquamation. So, in viral hemorrhagic fever, at first is the case definition. This can occur due to Ebola, Marburg, Arenaviruses and Dengue. Patient, along with fever, the patient will have headache, muscle pain, and erythematous maculopapular rash on the trunk with fine discrimination. There will not be any predisposing factor for hemorrhagic manifestations and no established alternative diagnosis. কোনো আর বাকি সমস্ত ব্লিডিং ডায়াগনোসিসগুলো সব সময় নেগেটিভ থাকবে, and there will be 3 to 4 days after the onset of rash there will be vomiting, diarrhea and abdominal pain, thrombocytopenia and bleeding not related to injury. Pharyngitis is seen in arenaviruses and retrosternal chest pain. History তে কি কি থাকবে? আরেকটা জিনিস হচ্ছে এরকম travel to endemic areas even if non specific, history of tick on mosquito bites, contact with mice or their excreta, and history of contact with patient with these risk factors and viral hemorrhagic symptoms. নন স্পেসিফিক ল্যাবরেটরিতে কি পাবো? লিউকোপেনিয়া, থ্রম্বোসাইটোপেনিয়া and elevated liver function test, coagulation abnormalities, prolonged bleeding time, PT and partial thromboplastin time will be increased, decreased fibrinogen leading to DIC. Specific diagnostic tests in hemorrhagic fever, antigen detection is done by PCR, which is an early rapid diagnostic test. The lab should be done in a second to third category of bias with second to third biosafety level due to their infectious nature. And antigen detection is done by ELISA, IgM detection by ELISA. Due to this can help in late diagnosis after 10 days of onset of infection. And isolation of virus, This is done in only fourth category of biosafety level laboratory. This is for research laboratories only. Mainly আমরা diagnosis করি কিভাবে? ELISAর মাধ্যমে diagnosis করি. This is a rapid diagnostic test, can be done within the 10 days of onset of infection. Okay. Treatment. There is only supportive treatment. Fluid and electrolyte balance. This is supplemental oxygen and mechanical ventilation is done in case of severe cases. For Lassa and Ebola Marburg viruses, there has been no FDA approved antiviral agents. Ribavirin is used in Arenaviruses and Bunyaviruses, and anticoagulant therapies are contraindicated. Aspirin and NSAIDs are also contraindicated. Okay. And supportive treatment kirokom deya hoy? Circulatory support, BP, vasopressors are given to maintain the BP. Platelets, platelet concentration is given in dengue patients. Fibrin is given, pain control, and secondary infections are also managed. Okay. Immunization, there is passive immunization is done. Immune plasma in arenaviruses, whole blood from the Ebola survivors. Live attenuated vaccine is available for yellow fever viruses. Inactivated virus for dengue fever virus is under trial. Vaccine for Junin and Rift Valley viruses are also under trial. Now, how to control this hemorrhagic fever viruses? Standard precautions. Report the suspected cases immediately to infection control officers. Isolation of the suspected cases. Strict hand washing, double gloving, and use of impermeable gowns, personal protective equipments, N95 masks, negative pressure isolation, face shields and goggles, and all these contacts and patients diagnosed with viral hemorrhagic fever, including hospital personnel and lab workers, also to be placed under medical surveillance for signs of viral hemorrhagic infection for 21 days. Notification. জানতে পারলে আমরা হসপিটালে যদি জানতে পারি কিভাবে নোটিফাই করব, ইনফেকশাস ডিজিজ কনসালটেন্টকে জানাতে হবে, ইনফেকশন কন্ট্রোল কমিটিকে সঙ্গে সঙ্গে জানাতে হবে। ওকে, এগুলো স্পেসিমেন কালেকশনের সময় কি কি ইউজ করব? সিডিসি রেকমেন্ডেশন, ফুল ফেস শিল্ড অর গগলস, মাস্ক টু কভার অল অফ দ্য নোজ অ্যান্ড মাউথ, গ্লাভস, fluid resistant impermeable gowns, and additional PPE must be used. Specimen handling, how to do this? For suspected Ebola cases, routine laboratory testing, this includes traditional testing. This is always done with full face shield or goggles and mask to cover all of the nose and mouth and impermeable gowns, and is done in a class 2 biosafety cabinet. Okay. যদি এরকম হয়ে যায় পোস্ট এক্সপোজার, হাউ টু ডু দ্য পোস্ট এক্সপোজার প্রোফাইল্যাক্সিস? একটা পেশেন্টের হ্যান্ডেল করতে গিয়ে তো এরকম ইনফেক্টেড হয়ে গেছে, তাহলে পোস্ট এক্সপোজার প্রোফাইল্যাক্সিস কিভাবে করব? There are no specific vaccines or antiviral agents. For percutaneous or mucocutaneous exposure, immediately wash an affected skin with soap and water, flush the eyes. For the high risk exposure and close contacts, place the patient under medical surveillance and record temperature for two times per day. Report any temperature more than 38 degrees Celsius and report any signs and symptoms of viral hemorrhagic fever. And কোনো কিছু develop করলে signs and symptoms, start ribavirin only for arenavirus and bunyaviruses. Okay. This is not recommended in the absence of any clinical illness. Antiviral therapy is not given if the patient does not have any clinical illness. Okay. Mainly is quick reporting of the system and immediate diagnosis and starting of the treatment. Okay.